Hey everybody, this is Dr. Michael Scherer. In this training video, we're going to be talking a little bit about how we handle our LOCATOR angled abutment, how we can use it, place it, move it around, as well as the different positions of how it would fit into our patient's mouth and implants. I've got a setup right in front of me here of a simulated patient that I've just gone ahead and I measured the soft tissue depth. I've then ordered my LOCATOR and LOCATOR angled abutments, replaced the healing abutments, and now the patient comes back in for me to place the abutments and then maybe to make final impressions or do the chairside pickup for their prosthesis. So in my simulated example, it's also helpful if you would like to follow along, have your technique manual out in front of you, either in PDF form or in physical print copy form. So I'm going to open that up here to page number 9. And on page number 9, we have all the information for how we go ahead and we follow along with this procedure. So I'm going to go ahead and jump right in. So in front of us here, we've got our simulated patient that we've just gone ahead and we removed the healing abutments. And I have a little tiny box to the side. Now, our abutments don't come in these little boxes. They come in little sachet pouches. But this is my example training series of how we go ahead and we work with these parts and pieces. And this is also my little angle measurement guide that you can also purchase from Zest. It does not come with your LOCATOR angled abutment, but you can purchase secondarily. Additionally, I've got my angled driver, which is an 050 hex driver. And then I'm going to also demonstrate this with my 2 straight locators here in the front, or my standard locators, and placing those using the traditional core tool. And then also I've got my 2 standard LOCATOR abutments, my 2.5 millimeter cuff heights for my anterior 2 implants, and then my 3.5 millimeter distal for the number 19, number 30-ish implants that are going to be for my angled 15-degree implants. Also, I've got some paralleling posts that do really make this procedure very easy to go ahead and follow along with. Now, each of the LOCATOR angled abutments does come with a paralleling post. So then that's something that is very nice and very easy to go ahead and follow along with this procedure. Now, as I go ahead and I move these to the side, I've already made my measurements of all 4 of my implants. As mentioned, I've got 2 2.5 millimeter standard locators for the front, and I've got 2 3.5 millimeter LOCATOR angled for the posterior. Starting out with my LOCATOR standard abutments, or my straight locators, I'm going to go ahead and take this with my core tool or my manual driver tool, and there's a triangle end on each one of those tools, and I'm going to match that with the triangle portion of my LOCATOR abutment. Now, I have a little snap that goes over the top of these, and these are just available from Zest that allows my abutment to kind of lock into place. Once I remove the healing abutment, I air dry the inside of the LOCATOR, make sure it's, or the implant, make sure it's dry, and then I place my LOCATOR on. Sometimes it helps to give it a couple of reverse turns and then advance it forward until it's finger snug. Okay, and that's the perfect abutment height for a LOCATOR. Now I'm going to also place my other standard LOCATOR abutment. Healing abutment comes off, air dry, give it a couple of reverse turns, then advance it with a clockwise motion until it's finger snug, and now my implant abutments have been successfully placed, and these are both at the ideal height and positions. And what's helpful is you can also go ahead and grab one of these paralleling posts and just kind of get a general idea of the parallelism between your 2 front implants. And with my angle measuring guide, I can go ahead and take this, line it up to 1 implant, and then I can measure the angulation difference between the 2. So what happens now is I can see that these 2 are pretty parallel. You can see here an imaginary line in between the 2 in the front. I'm just going to kind of move it side to side, and those are pretty darn parallel. Now I'm going to pop those off to go ahead and make the placement of my posterior abutments with my LOCATOR angled easier. What I've got in front of me here is I have my LOCATOR angled abutment, and this is for my 3.5 millimeter internal hex implant that I have here as my demonstration. I also have my angled driver, which is an 050 hex driver. How we handle this abutment is a little bit different from what you're comfortable with here and what you've seen before with this traditional LOCATOR where we use that triangle end. This is going to be with the hex driver. So I place this into my abutment, and then I can place that using this hex driver. Now this is a 2-piece component. So what happens is if your screw does not come in the abutment, which happens in some of the LOCATOR angled abutments, you have a little tiny screw that is separated just like so. No big deal. Inside of here, you'll see that cylindrical LOCATOR angled, and then I've got my hex or my internal connection, depending upon your implant system. I'm going to go ahead and grab my retaining screw, and then I'm going to place it into my abutment. And then some systems I have to go ahead and screw that down into place, others it'll just slide right down. Now what we need to do is, this is after we've removed our healing abutment, we air dry that very well. The goal is you always want to go ahead and have a throat pack anytime that I'm working with tiny parts and pieces in the mouth. So as I do that, place my throat pack, then I'm going to take my driver inside like this, place it into a proposed position on the patient's arch. Now I'm going to purposely mess this up at first, because as I place this into here, I'm going to go, well, is that the right position? I'm not so sure exactly where I'm positioning it. I have 6 possible implant positions that I can tighten it down to. So I can go ahead and place that and say, gosh, okay, I tighten it down. Did I get it? Yeah, I think it's starting to get pretty tight. Okay, and it's starting to get snug right there. Great. I just placed my LOCATOR angled abutment. I can pop my paralleling posts on there, and this is why these are so important for LOCATOR angled, because we're going to see here that I actually have my implant off angled. No problem. That's easy to fix. I'm going to pop this off, and now I'm going to unscrew my LOCATOR angled abutment, and I'm going to move it into a different position. So it's a little tricky to do and to show that on a video. So I'm going to show this up close, pretending like the patient's cheek is not there. So I can take this and just kind of move this around all sorts of different positions. So as I do that, I'm just moving it. Now you can do that in one of 2 ways. You can either use a driver like this, or you can use your fingers to go ahead and position it correctly. I usually use a combination of the 2. And that does look pretty good, looking at it from a few different angles before I tighten it down. And what I recommend doing is just doing a light finger tight, very light, and then popping on that parallel post to measure my angulation. Okay, I'm starting to look pretty good here. Oh yeah, that's looking perfect. That's parallel. I recommend taking a methodical approach when utilizing LOCATOR angled, measuring your angulation prior to torquing or heavy finger snug pressure. The reason for that is especially in deeper conical connection implants, things can get pretty tight along the walls of the implant. So I recommend very light finger snug, making sure it's down all the way, protecting the patient's airway with a throat pack, tightening it down till it's just barely finger tight, popping on parallel posts to verify your position. Because if I really tighten it down, it's kind of a little bit more work to remove. We do have some other instruments and some steps here that I can show you in a later video on how to go ahead and take out your abutment. But the general idea is that there is a abutment removal screw that Zest has available for really tight or deep conical connection implants. And also there is a recommendation to use like a padded hemostat to go ahead and remove your LOCATOR abutment. We generally don't recommend removing your LOCATOR abutment with a sharp instrument or with something that is unpadded like a traditional hemostat. So always protect your LOCATOR abutments. Now the reason we also do this before torquing is it gives me the easy ability to reposition the implant to match the correct angulation for what my goals are in this scenario. I was able to get it at this point. Now we're ready to go ahead and torque it down. So now once I've gone ahead and I verified that my position looks pretty good and I'm happy with my angulation, I'm ready to go ahead and move on to my other angled implant. So I've removed the healing abutment, air dried it, and now I'm ready to go ahead and place on my other angled abutment. This one, the screw's already inside, so I'm going to go ahead and just pop that onto my driver. And now what I'm going to do is place that, again with a throat pack protecting the back of the mouth. I'm going to tighten that down until it's the appropriate position. You can see here that's not the appropriate position. It looks angled. So I'm going to back it out a little bit, reposition it. Reposition, good, that looks nice. That looks nice. And again, everybody, I'm pretending like the cheek is not there. It's a little tricky to do on the patient, so you're going to be like this in the patient's mouth. Now I wanted to demonstrate that here so that way you can see it on the video. So you can see here, I'm going to go ahead and slowly tighten that down until it's just finger snug. And now at this point, I like to go ahead and take my parallel post, pop it on back here, pop it on back here. Those look pretty darn parallel. Pop on my other locators. And I'll do one last inspection here of all of my LOCATOR and LOCATOR angled abutments prior to doing a final torquing procedure. Now at this point, we're ready to go ahead and torque our locator and locator angled abutments down following manufacturer's recommendations. So if we open up here, page number 10 of our technique manual, you'll see here it's got a generally recommended protocol for how to go ahead and torque for your locator angled. Now keep in mind, doctors, that locator angled utilizes an 050 hex driver. Please do not try to torque your locator angled abutments utilizing your Nobel driver, your Straumann driver, and things of that nature. Now, there are some implant systems out there, such as ZimV or BioHorizons, that use an 050 hex driver. So in those scenarios, you can use your implant company specific torque insert. However, be cautious. Make sure that you are using an 050 hex driver for torquing your locator angled abutment down. So again, as a review, this is for your traditional locator abutments. This is for your locator angled. You cannot torque your locator angled using this core tool. And then also you cannot torque your locator standard non-angled implants with the 050 hex driver. Hey everybody, this is Dr. Michael Scherer. This has been our training video on how we go ahead and we do our basic handling for our locator angled abutments.